doing that on purpose? Or can't you make up your mind?
That's the trouble. I can't make up my mind. I haven't got a brain. Only straw.
How can you talk if you haven't got a brain?
I don't know. But some people without brains do an awful lot of talking, don't they?
Yes, I guess you're right.
The function of the cranium is to protect the brain. The cranium consists of 8 bones, which articulate with synarthrotic, immovable joints. The cranium bones are as follows:
occipital bone,
temporal bone,
parietal bone,
frontal bone,
sphenoid bone,
ethmoid bone. There are 4 main lobes of the brain. The 2 frontal lobes sit behind the frontal bone and control our ability to plan, organize, and problem solve in...
Come on, Meredith. You can't remember this one. It's memory. Duh. Oh, I recognize these lobes of the brain. That's because I have a very active temporal lobe. Unlike Meredith over there with her memory.
Hey!
Ironically, they sit behind the temporal bone. Pretty ironic, right? This lobe also helps us understand speech and,
Really, Jamie? You just made fun of me for this one? Come on, it's memory. Behind the parietal bone, we will find the corresponding lobe. Shocker, right? This lobe helps us to move our bodies and helps us to feel touch. It also helps us not to look like drunken fools when we're walking around.
Could you guess which lobe sits behind the occipital bone? If you guessed occipital lobe, you're right. Do you see the lobe there in blue? Or are you just saying that you see it? Do you really see it? Can you guess what it controls?
The spinal cord attaches at the base of the brain and extends caudally down the dorsal side of the body.
It runs through the vertebral foramen, a large hole in the base of the skull.
This is a spinal cord, and it's basically the fast-track elevator to the brain. Signals run up and down this fast-track elevator from the body to the brain and back. The portion we see here is part of the central nervous system. It is encompassed in the spine for protection.
This is the peripheral nervous system. It is a compilation of nerves that extend from the central nervous system and venture out to various parts of the body. These nerves allow us not only to feel pain and pleasure, but they also help us to breathe, regulate our internal organs, and allow us not to defecate on ourselves in public. During neurosurgery, the brain is under a lot of stress. This can cause a misfire of the electrical currents traveling to and from your brain, resulting in a seizure. There are 4 different types of seizures.
Absent petit mal seizures are short periods of time with loss of attention.
So are you saying this is what I have every day in my surge class?
No, Jamie, that's ADD.
Oh. A tonic, or drop seizure, is the sudden loss of ability to control your muscles. You may drop to the ground.
Myoclonic seizures is when the muscles in the body contract. Have you ever had hiccups or experienced jerking when falling asleep?
Yeah.
Then you've experienced a myoclonic seizure.
Tonic-clonic. This is the grand mal of all seizures. This is your typical loss of consciousness, on the ground, muscle jerking seizure.
To determine the correct medication to treat a seizure, the doctor may run an EEG, electrocephalogram, to record the activity of your brain. There are multiple medications regulated to treat seizures, such as carbamazepine. Intracranial pressure is an increase in fluid and pressure in and around the brain. This can be caused by a tumor, a blood clot, hemorrhaging of the brain, or aneurysm rupture. Symptoms are sudden vomiting, headache, blurred vision, confusion, high blood pressure, just to name a few.
ICP can be reduced by draining the fluids from the brain or the spine via shunt. Medications such as mannitol or hypertonic saline can be used. Ischemic infraction, otherwise known as a stroke. A blood clot travels to the brain and blocks circulation to a certain area of the brain. If the clot travels to the left side of the brain, causing a stroke, the right side of the body will be affected, and vice versa for the right side.
Watch for signs of stroke. F. Face. Ask for a smile. Does smile look uneven? A. Arm. Raise both arms. Is one weak? S. Speech. Ask to repeat a phrase. Is speech slurred? T. Time. Any one of these signs? Call 911 now. Act fast. Time matters.
Strokes can be treated medicinally with blood thinners to aid in restoring blood flow to the brain. After that, the patient may attend different forms of therapy.
Oh look, and here's me in my nurse aide uniform. I work in inpatient rehab for Mercy. We provide patients with speech therapy to challenge their thinking and communication skills, physical therapy to rebuild the muscle movements, and occupational therapy to reteach the patient skills such as cooking and activities of daily life like showering.
As with any surgery, the risk of post-op infection is always present. Post-operative central nervous system infection always calls for an emergency trip to the ER. Left untreated, it can develop into brain abscess, which is pus produced in the brain, meningitis, swelling of the brain and spinal cord due to infection, or subdural epemia, pus between the dura and arachnoid matter. A brain abscess and subdural epidemia will require another surgery to remove the abscess. Meningitis is treated with IV antibiotic.
Why, if I had a brain, I could while away the hours, conferring with the flowers, consulting with the rain. In my head, I'd be scratching while my thoughts were busy hatching if I only had a brain. I'd unravel every riddle for any individual in trouble or in pain.
With the thoughts you'd be thinking you could be an operator if you only had a brain.
Oh, I will tell you why. The ocean's near the shore. I could think of things I never thought before.
And then I'd sit